Our next presenter has over 15 years experience in business management and has spent the last 4.5 years working in health promotion at the Canadian Cancer Society. She brings her passion to health and wellness to the workplace as she provides support, information, and advice on workplace wellness initiatives to businesses through Wellness Fits, the Canadian Cancer Society's new and innovative workplace wellness program. Please help me in welcoming Ms. Sue McPhail.
I'm going to, whoa, was that loud? Is that better? I'm going to tell you a little bit about Wellness Fits, and I'm happy to be a good news presenter after listening to Mike talk this morning. I'm definitely a good news presenter, so it always feels good to start from that mindset. I'm going to tell you about Wellness Fits, which is our free resource that I'm hoping will be of value to you. I'm going to tell a little bit about the business case for workplace wellness. Mike stole my thunder a little bit, but it doesn't hurt to see some of these stats and these figures again. And then I'm going to show you our Wellness Fits program resources and how you can access those and hopefully use them in your organization. And then leave you with some key success factors to building a successful workplace wellness program. Before we start, I'd just like to ask a quick question. By raising your hand, can you raise your hand if you have wellness activities currently in your organization for your employees? Okay, great. Okay, good to see. So that's hopefully for those of you that do, you will have some more resources, and for those of you who don't yet, you'll see a way to start to implement some through our program. So, what is Wellness Fits? Wellness Fits is an approach to enhancing the health of employees that relies on and builds upon the efforts of employers to support employees in the steps they're going to take to care for their well-being. So it's that connection between employees and employers. We heard Mike talk about how much time we spend in the workplace and how the workplace is a great setting for health promotion activities. And we're looking, what we've done with our program is looking at it from an approach of employees and employers working together. It's a dual responsibility. So we've heard a few stats about cancer and chronic disease prevention. Here's ours. 2 in 5 Canadians will develop cancer in their lifetime. The good news is about half of all cancers are preventable. 36% of adults suffer from one or more chronic conditions, so the other chronic disease. The good news is that a healthy lifestyle following recommended screening and early detection guidelines can significantly contribute to reducing cancer and other chronic disease. You know, the 2 in 5 stat is a reality. The reality also is that more people are surviving their cancer diagnosis. For any of you in the room who've been touched by cancer, and if I were to ask you to raise your hands, I would bet that 90% of you would put your hands up, whether a family member or someone you know. If you have been, then the good news is that half of all cancers can be prevented. And to me, that empowers me. I lost my dad to cancer, and so when I hear that stat, I think, okay, I can do something. There's no guarantee. If you do all the things I'm going to talk about today, you're not going to walk away and be guaranteed that you won't get cancer, but if there is something you can do, why wouldn't you? So that's a big part of our message. So the business case, we know that for health reasons, it's important that we take care of our health. We need to do what we can to prevent cancer and other chronic disease. But here's some more stats. Mike gave you some earlier. This is from 42 studies. They're US studies, and they showed that the health promotion programs average 25% reduction in sick leave absenteeism, 25% reduction in health costs for the employer, an average of 32% reduction in workers' compensation and disability management claim costs. So there is lots of evidence telling us that there is a strong business case for an employer to want to promote healthy lifestyles and improve the health of their employees. You know, this is another interesting business case piece. Studies confirm that workplace wellness programs are effective at improving employee engagement, boosting morale, and increasing productivity. And you know, Paul touched on serving your clients, and if you look at increasing productivity, I think in the context of the organizations that you work in, that's healthier employees are happier, and hopefully you'll have happier clients because they're able to serve their clients better. I think this is a very powerful stat, this Towers-Perrin Global Workplace Survey study. It showed that the most powerful influencer of employee engagement was found to be the knowledge that senior management is sincerely interested in my well-being. I heard Paul talk about that when he started this morning, talking about how he feels about his employees. If someone said to me, I care about your health and well-being, hey, that means a lot to me. So think that your employees will be more engaged if they know that you sincerely care about their health and well-being. Who wouldn't be? Sometimes I think we get stopped by barriers around, well, we don't want to interfere in our employees' lives and their health is their business, but people want to know that their employer sincerely cares about them. So here's some more stats around, some Canadian stats around the business case. BC Hydro, they have had a comprehensive workplace wellness program in place for quite a few years now, so they do have stats to show that they managed to reduce their sick leave costs by 1.2 million. Vancouver Airport also have been quite a leader in the area of workplace wellness, and they could show that they had managed to reduce their hours lost. Canada Life in Toronto, return of investment, and the Canadian government return of investment. So sometimes these are larger organizations. That's generally where we get the stats from. That doesn't mean to say that smaller organizations can't see those returns. It's a little bit harder to track and evaluate, but I think the message that we really want to get across is that if you start to implement programs in your workplace, you will see results. It might not happen for a year or 2 years before you actually start looking at your absenteeism figures and see changes. It takes time. You need to be committed to this, and it will take time, but you can see results even if you're a smaller organization. So the Wellness Fits program. This is the good news piece. So we know that there's a business case. We know we should do, so what can we do? So I'm very happy to talk to you about the Wellness Fits program. It is a program that provides employers with free, I'm just going to say that again one more time, it's free, expertise and tools to help you create opportunities in your workplace for your employees. So this is a program for the employer. And I'm going to show you and talk about the resources that are available to you. And it's free, if I didn't mention that already. You don't get many free things, and this is not a sales pitch, it really is free. The program covers several topics that are directly related to cancer and chronic disease prevention. So some of the things that Mike talked about, and I'm going to go over the topics that are covered in our program. Our approach and our program model is actually an evidence-based model. So it's based on the Health Communication Unit model in the University of Toronto. And the approach is based on educate, act, and support. So provide people with educational information, so reasons as to why they should eat better, be more active, not smoke. So provide the education. Give your employees then an opportunity to change their behavior or improve their behavior, and that's the ACT section. So in the ACT section, you'll find ready-made challenges to help you try to eat better or be more active, or quit smoking. And then the third part of the model is support. So that's where the workplace can access tools to help them support a healthy workplace. So I'm presuming that there was a supportive workplace or supportive environment here for us to eat well today. It looks like there's fresh fruit and there's some healthy choices for breakfast. So support could be having policies in place around serving healthy food options at meetings. And so there's lots of information in there for the employer about how they can provide that supportive environment. Sometimes a supportive environment can be having a fridge and a microwave so that your employees can bring lunch if they're working late shifts or evening dinners, and so they can bring their own meal and not be trying to eat out. People generally eat better when they bring their own lunch. So that's our approach and how the program is built. And our program is a partnership with the Canadian Cancer Society BC and Yukon Division, who I work for, and the province of BC through their Healthy Families BC initiative. So the Canadian Cancer Society developed the program about 2.5 years ago now. It's still fairly new. I was involved in the program development. If you're thinking, why is the Canadian Cancer Society involved in workplace wellness? Well, prevention is a priority for us as an organization. So we fund research, we provide support programs for people living with cancer, but we also have prevention as one of our priorities. We want to help people reduce their risk. And so Wellness fits into our prevention mandate. And so this is one of our prevention programs. So we developed the program. We saw that there was an interest and a need to provide resources to employers that were free. And then the province, who is also interested in supporting healthy workplaces, heard about our program and decided that they would support our program too, which is very exciting for us. It's enabling us to stand here today and for us to extend the reach of our program to a broader audience. We have health promotion coordinators around the province, so our program is available throughout the whole of BC. So let me tell you a little bit about the program itself. Oh, let's start on the topics first. So what can you find? What type of information can you find? You can find information on being tobacco-free, healthy eating, physical activity. We've seen all the stats. Those are the things that we know directly relate to cancer and chronic disease prevention. And these are topics that we have control over. They're behaviors that we have control over. Healthy Minds, the Healthy Minds module looks at mental health and wellness in the workplace, and that module we actually developed in a partnership or collaboration with the Canadian Mental Health Association. So they reviewed all of our resources and our information to make sure it was credible and appropriate. And just on all of the information that you'll find on our website, we are an evidence-based organization. We're a trusted voice on cancer. So all the information you'll find through our website, know that it's credible. You won't see the latest headline about lemons curing cancer or green tea, or it's all evidence-based, credible information. So I think sometimes we see so much information, especially around healthy eating. And Desiree and we were just talking about that earlier. You see so much information about, should you drink coffee? Should you not drink coffee? How many cups should you have? 1 glass of wine? 2 glasses of wine? So know that, yeah, 3, 4, did you say? Yeah. Did you know that women are supposed to, so the recommendations is that for women, 1 drink or less a day, and men 2. What's with that? Like, my husband can drink 2 and I gotta sip on my 1 if I want to take care of my health. Anyway, sidetrack there. So know that the information is credible that you'll find on our website. Healthy Minds, tobacco-free, healthy eating, physical activity, sun and UV radiation. Skin cancer is now the most common cancer in Canada. Most of those are non-melanomas, which are very treatable, but we do need to start being more aware of how we expose ourselves to the sun. So those modules are all developed and available on the website. In development are living with cancer. That's going to be a module that has resources for people who maybe have a colleague in their workplace who's going on a cancer journey or a family member. Early detection and screening is just about to be uploaded. It looks at the screenings that are available for chronic cancer and other chronic diseases. And environmental health will look at environmental carcinogens in the workplace. So those are being developed right now. So our program resources are available through our website, and I'm going to take you to the website and show you how to navigate it and access them. You could go away today and access some of these resources straight away. Our program is available through 2 different streams. The advanced program is available for medium and large size businesses, and you will be connected with a Canadian Cancer Society staff at one of our regional offices or a trained volunteer, and they will work directly with someone in the workplace. We call them our workplace champions. Someone in your workplace that we'll work with to help plan a program that works for you using our resources. We have online resources, materials, will help you plan, will help you survey your employees to find out where their interest is. If you're a smaller business or you are quite happy doing your own thing, we have our self-serve program. And I'm going to show you how you can access the self-serve program right now. And self-serve basically means you can do it yourself. However, we're there to help support you. We offer a toll-free support line, and at the end of that toll-free support line, it takes you to a call center in India. No, it takes you to me. Takes you to myself and Elisa, my colleague that's sitting over here. So sometimes when you see those toll-free support lines, you think, where did they go? So we're actually at the end of that toll-free support line, and we love it when the phone rings. So if you have any questions on the resources or how you can use those resources to suit your organization, because every organization is different, and I'm sure there are challenges with every type of industry. We are actually working with Possibilities right now. They're about to launch the Wellness Fits program, so know that we can make it work for different work environments. So the self-serve program, you can access all the resources and call our support line to ask for our help and advice. So I'm just going to take you to the website. So wellnessfits.ca is our website, and it's a public website. Anyone can access it. Here you can, if you're looking for some of the information I talked about earlier as to why workplace wellness, you can access that. So the business case, the health case, information about the partnership and our approach that I talked about, and a little bit of a short information about the topics that you're going to find on there. And then the 2 program options. I'm just going to go back up to that. So just to talk about the difference between the 2 programs, if you decide you're interested in using the program, what would work best? So the self-serve program, as I mentioned, you have access to the toll-free support line. You can go and log in and access all the resources yourself. They're all in download in PDFs that you can download, and it's paper content. So you can take the information and run a challenge. People can track, your employees can track their physical activity through paper tracking sheets that are downloadable from the website. The advanced program is a little bit more, I guess, it's a little bit more of a commitment from you as an organization. We will work with you for free. Once again, this is a free program. There is no charge for it. We will work with you to help you implement the program in your workplace. We will help you implement an employee interest survey to find out where your employee's interest is. That's a really important component of a wellness program, is finding out what your employees are interested in and what they want. Maybe what you want isn't necessarily what they want to be doing. We'll help you to, we'll show you how to use the resources through an online application. So you actually get access to, it's almost like your own mini server, and the website has some screenshots of what the online application looks like. So all the resources are delivered in an online setting. So this would be, we call it our dashboard. It's like the home page. So say this was for CSBT, this would be your own homepage that your employees can log into. They'll have their own login to. They can see what challenge is running. They can, there's always going to be a message from the Canadian Cancer Society, but then you can also put your own announcements underneath. And then this would be an example of the healthy eating module, and a challenge is running right now. As an administrator, you can see how many people are participating in the challenge. You don't get, all the information that the employees are loading into the online application is confidential. You're getting aggregate sort of numbers of who's participating and how well they're doing. So this would be, this screenshot would be me tracking my healthy eating challenge. This would be the view from an administrator function. This is how you, as an administrator, you would invite your employees to join the program. You would create an account for them, send them an email, and then they could then go and create their own login to their own dashboard. And this is an example of what the online tracking looks like for the healthy eating challenge on the online application. So drop-down menu, and you can track how many fruits and vegetables you're eating each day. That's one of the first steps in the healthy eating challenge. So these are the screenshots that show you what the online application looks like. So the advanced program, the program is delivered through the online application, or you could also still use the paper version. So for some employees in your organizations, maybe they're not accessing a computer, and it might be easier for them to be able to track online, or to put up posters, or to post the educational information. So it can work in both ways. So the advanced program, you'll have your own online application. You'll be hooked up with a Canadian Cancer Society staff or trained volunteer, and they will work with you to plan out your program and to implement it, use the application, invite employees, and they're also experts in workplace wellness. So they'll give you advice on other things that you might want to offer during one of the challenges. We suggest that maybe if you're running the Healthy Eating Challenge, you invite a dietitian in, like the one we're going to hear from next, to do a lunch and learn on some of the, provide more information to support what you're doing. So once you have checked out the website, you then decide that you actually want to get started today. And if you click on this button, it'll take you to this screen. And from here, you can decide which program you're interested in. If you're interested in the self-serve program, you click sign up here, and you just fill out some basic information about yourself and your organization, and then the system will then send you an email that'll enable you to log into another part of the website that I'm going to show you now. And if you were interested in the advanced program, then it's an application process. So you would fill out the same information. We then get an email in our office that you are interested, and then myself or Elisa would contact you and just talk a little bit more about the organization and make sure it's a good fit, and then we would take it from there. In the interim, you will also have access to, you'll be sent an email so that you can log in and access the self-serve program resources. So I'm just going to log in to the module part of the website. So once you have your login, you click here. And so many passwords these days. It's like this is the moment when you go, I forgot the wrong passport. So this is where this will take to you when you log in. Just a reminder that we're here to help. That's our toll-free support line. We have loaded an employee interest survey as one of the resources. Again, we do really recommend that you ask your employees where their interest is. And then the modules are laid out in the same way, and they all have an action plan, which will help you to plan out what you're going to do. There's a lot of information on the website, and sometimes I think people get there and they go, oh my goodness, there's so much information, where do I start? So feel free to call us if you get to that point, but also remember, whatever you do, whether it's deciding to post some of the educational fact sheets and create some education, you're taking a step towards improving your employee health and wellness. So if it seems like implementing a comprehensive program seems overwhelming right now, then please know that whatever you do, whatever steps you take will help. So here you can basically click on each module, has the PDF resources, and they're all laid out under those three areas: educate, act, and support. So each of the modules is laid out exactly the same way. Healthy Minds, tobacco-free. I've just downloaded some of them for ease. When you download them, you'll see a table of contents. So this is the Healthy Eating Module Education Tools, and it's like fact sheets. So you'll have a fact sheets on the topics that are listed here. Fruits and vegetables, fiber scorecard, fat facts, red and processed meat. So you can print them off and post them as posters. You could take some of the content and communicate it to your employees in the way that you normally communicate with employees. I find that the ideas and suggestion sheets, which are the first item on each of these PDF packages, are great places to start with if you're just looking for some quick ideas of things that you can do. So that would be an educate package. This is an ACT for the physical activity module, and in this section you're going to find everything you need to run the Fall Into Motion Challenge. So the Fall Into Motion Challenge is a team or individual challenge to encourage your employees to be more active. And so here you'll find sign-up sheets, posters, tracking sheets, and basically everything that you would need. And then in the support section, this is a Healthy Minds module, support tools. You'll find sample policies. You'll find information about other things you can do, links to other resources. There's a lot of amazing resources around mental health and wellness in the workplace now, especially with the recent legislation that came into place. So there's a lot of great free resources, and that links to all of them. So to access these, you basically just sign in and then download these PDF packages and use them in whatever way you would like to. So I am just going to go back to my presentation because I think I'm running out of time. Which I can't find. Nope. There it is. So that's the website. I want to leave you with some key tips to getting started. So if you're sitting there thinking, okay, that all looks great, now what do I do? How do I get started? Then I'm going to sort of talk about 5 key steps to take to really get started with making this happen. Because as we know what we should be doing, but sometimes it's harder to actually take action and do it. Then one of the most important things, or the most important thing for a successful workplace wellness program, is to get senior management, CEO buy-in. That might be you sitting in the room, or that might be someone in your organization. We know that wellness programs will be successful if there is buy-in at a senior management level. If the senior management are visibly participating in wellness activities, you will also see employees participate. One of the challenges sometimes with wellness programs is getting participation. You're gung-ho, everyone seems interested, but actually getting people engaged can be hard. So really, this piece is such an important part of it. If your management is walking the talk and encouraging people to participate, it will be successful. So think about if you're interested in starting a wellness program, who do you need to talk to get their buy-in? Do you need to present a business case to them? What do you need to do? The second step is to designate a wellness leader, or champion as we call them, or create a wellness committee. Again, a key success factor is to have someone this is their responsibility. You need to commit some time, maybe not a lot of financial resources to a workplace wellness program, but you need to be prepared to commit someone's time. So look for someone in your workplace who is interested in wellness. The champion can be a key success factor to the program. If they're not interested in wellness, they don't walk the talk, then they're not going to help engage the rest of the employees. So think of someone in your organization that would be interested, that is a good communicator, that is well liked. The champion is key. If you're going to form a wellness committee, that's also a best practices approach. When you invite employees to be part of the process, again, often you'll see more engagement in the program. All levels of management in that wellness committee, and it gives employees an opportunity to talk about what they would like to see in a wellness program. So a wellness committee, again, should be people that are interested, that want to be there, that are well liked in the organization, that will help to encourage participation with the rest of the employees. Think about your available resources. Again, I've mentioned you need to commit some time, but you don't have to put a lot of financial resources into this. It helps if you can. So for example, putting together a budget for some free incentives or rewards for the challenges. It can be Starbucks cards every week for a draw for everyone who's participating. It doesn't have to be a high value reward. It can be, having some fresh fruit once a week during the healthy eating challenge available to your employees. So putting some financial resources towards incentives and rewards definitely helps. People like free things. That's the reality of it. We do things when we get rewards. So that works too. You definitely need to think about the human resource time side of it. If someone is doing this off the side of their desk, it's not workplace wellness. They're stressed. It's something else I have to do. My boss told me I have to do. So really be committed to dedicating some time. And there's a free program that you can use called Wellness Fits that's free. So please call us and use our resources. Another important step is determine the needs and interests of your employees. I've mentioned that a couple of times. So you can do that through an interest survey. If you're in the advanced program, we'll set up a survey link for you. It can be done very easily. It's confidential. We'll give you just a summary of where the interest is. You might think that your employees should be interested in stress in their workplace. What you might find is actually they're really interested in healthy eating, or how do they like to learn, and what types of things would they like to see. People like to be asked. And then when you have that information, then you can start planning your activities. So again, to set yourselves up for success, take the time to really get through those steps. You don't need to walk away today or tomorrow start planning the program. Think about setting up the key things that are going to make your program successful, that will help to get as many of your employees as possible engaged in the program, and hopefully you'll see some very positive outcomes as a result of that. With the advanced program, we do have some evaluation built into the program, so you will be able to see, you know, when employees have participated in a challenge, did it change their behavior? Has it been successful? So we have evaluation built into that.